I'm Dr. Germanwala. I'm an interventional cardiologist.
My name is Melissa McNabb. I'm an adult nurse practitioner.
My name is David Jayakar. I am actually an open heart surgeon.
I'm Dr. Jim Harrell. I'm a cardiothoracic surgeon.
I'm Caitlin Small. I'm an RN.
I'm Crystal Jones, LVN.
Hello, my name is Randall Williams. I'm 73 years old. This is my wife, Ernestine. I was going through congestive heart failure. I got real short-winded to the point that I couldn't walk from my house to the mailbox without just being give out.
So Mr. Williams came to see us. He was not going to be a good candidate for surgical valve replacement. So the decision was made by the valve team to do TAVR, trans-aortic valve replacement. He was an excellent candidate for that and did wonderful through the procedures, was discharged home on day 3. Came back to see us actually about a month after his procedure, and his heart function before surgery was around 20%, and after we placed the new valve in his heart function has increased by almost 50%.
So the TAVR screening includes a heart cath, CT scans, an echocardiogram, pulmonary function test, carotid ultrasounds, and then an office visit with Melissa McNabb. With that office visit, you'll have mini questionnaires, a mini mental exam, and hand strengthening.
So TAVR stands for transcatheter aortic valve replacement. This is a new and innovative technique that has been out for about 7 years in the United States, where we're able to put an artificial valve in patients through the groin. Generally, that's the preferred access route, but through minimally invasive surgery, just a small cut or just an incision in the groin, we're able to put in a new artificial valve in the aortic position for a lot of patients that couldn't handle surgery the more traditional open thoracic way.
TAVR point of view, these are options available now for patients who did not have any options at all before. These are very poor surgical candidates for aortic valve replacement. So currently we are able to do this without general anesthesia. And the vision we have is we're able to provide a very minimally invasive option for patients who need aortic valve replacement. We currently have done around 100 patients, and we've had excellent results. We usually replace the aortic valve with either a pig valve or a cow valve. They have 1 or 2 small incisions in the groin, and generally we don't even put them to sleep. We keep them in the twilight zone with local anesthesia, and they usually go home in 3 days. So as a surgical team, we work with cardiology in a very collaborative manner. So we are involved from the start to the end of the procedure, and then we follow with them and help to get the patient through. We get patients from Texarkana, Nacogdoches, and from various other areas nearby. And we are the only program that has both the surgical minimally invasive and the TAVI program under one roof. So when patients come to Long Beach Regional, they get the best of both.
So TAVR is a very good option for lots of patients. So patients that are at higher risk or extreme risk or even intermediate risk, there is now great data that shows that TAVR is just as safe of an operation, and in some cases even a better operation, because it allows for the patient to get going right away. The recovery time is 2 to 3 days in a hospital as opposed to 7 to 10 days, and the chances for other comorbidities to occur is quite a bit less. So because of that, there are lots of patients, particularly or patients in their 80s and 90s, that typically wouldn't be able to receive surgical aortic valve replacement. In these cases, they now have another option. So our biggest goal for patients with TAVR is to get them back on their feet right away. We really want them to have a quick recovery, generally 2 to 3 days in the hospital. Recuperation time after that is about 2 weeks. Most of them come back to the office. Now that we've done 100, we can certainly see that the impact on these patients is within a couple of weeks. They're feeling much better. Not only have we improved in their mortality, and they hopefully will be around a lot longer for their loved ones, but also very importantly, they feel better. Their shortness of breath is better, they're not passing out, the chest heaviness is gone. So usually within a couple of weeks, they notice a significant improvement. And one of the nice things about TAVR at our institution at Longview Regional is that we're able to offer this with conscious sedation. So that means we don't even put our patients completely to sleep with general anesthesia. We can actually put them in a twilight zone and replace the artificial valve. In some patients, that's a much easier option. And for many patients that are very aged and frail, putting them to sleep is not a possibility. Okay, yes. So
That's small.
yeah, so it's that small when it goes in, but when it expands,
Yes.
it becomes the size. We have 4 sizes.
I had the TAVR procedure done at Longview Regional Hospital, and the team with Dr. Jeremy Waller, Melissa McNabb, and the nurses, and all those that worked with them. I thank the Lord for them and for their knowledge and their expertise in what they've done, and it's been a blessing. After the procedure was done, and I started gaining my strength back, I realized that I could do the things I've been wanting to do for the last 2 or 3 years. And I wasn't physically able, but now I'm pretty much back. I'm not 100%. I've got a ways to go yet. And my health is coming back. It's not been a real rapid process, but I'm on my way back. And we, in the past, have done quite a bit of traveling, been on a few cruises. And our goal, I think, would be to be able to do some of that again. I want to be able to go with her and on a special trip or something special for our anniversary, and be the husband that she married. And but this has been the love of my life. God couldn't have picked anyone better for me than Ernestine. I love her with all my heart.
This program has been an absolute joy to be a part of. It's an amazing program. We've been able to really change people's lives.
It's been a wonderful program from the standpoint of our patients, especially those patients who can't have an open aortic valve replacement to replace diseased valves that are causing them a lot of trouble with their heart.
We're so proud of our transcatheter aortic valve or TAVR program here at Longview Regional. We were the first in East Texas, and Dr. Jayakar and myself have really pioneered and been able to set aside a program that has done remarkably well. We're so happy with the TAVR program, particularly our nurses, nurse practitioners, hospitals, marketing department. Everybody's done such a fabulous job with allowing our program to do so well. So we really appreciate that.
Crystal and I, along with the several TAVR patients, would like to thank Dr. Jeremy Waller, Dr. Jayakar, Dr. Harrell, and Melissa McNabb for offering the TAVR procedure not only to East Texas but the surrounding communities.
Thank you for allowing us to be a part of this amazing, dedicated team. We really appreciate you all.
Folks, you don't have to go off to Houston or Dallas, anywhere else to get the kind of medical treatment that I've had. It's available right here in Longview.